A video on disease prevention questioning if an aspirin a day will keep cancer away by Caleb Birch and ABE 201. To begin with some history, aspirin was first connected to helping prevent intestinal tumors and colon cancer in the 1970s. More recently, Rathwell and his colleagues published 3 famous reports. All 3 of them furthered the connection between aspirin and preventing regrowth of cancer. It helps most in colon cancer, but it has been reported 36% of patients taking daily aspirin were not diagnosed with metastatic cancer, cancer that had spread throughout the entire body. But why aspirin? What is it doing? No one knows exactly the mechanism of how aspirin helps prevent cancer, said by Asad Umar, chief of the Gastrointestinal and Other Cancers Research Group of the National Cancer Institute. No one exactly knows what is in aspirin that helps prevent cancer. Some speculate it could be the anti-inflammatory properties, and others think aspirin somehow interferes with the processes in the body that allow tumors to grow. British studies have found people are less likely to develop cancer when taking daily aspirin. It seems to act as a preventative to cancer cells in our body. But how will this change in 2 years? In 2 years, cancer research has the potential to change forever. Once someone can determine definitively what and why aspirin is helping, it can then be modified so it more directly helps and takes away the negative side effects. The skills needed will not be too different than the skills needed today. Skills of a lab physician to analyze the aspirin, a physician to care for the patient, and an engineer to look at these problems in new and innovative ways so the lab technician and physician can do their job to the best of their ability. These skills can be obtained through practice and education of the topic. But now, how should engineers look at this problem? Engineers must report trials and research in an objective manner due to the repercussions of such information released to the public and the impact on society. Not all people can unanimously take aspirin. It does have negative side effects, such as gastrointestinal bleeding and hemorrhage from frequent use, only in some people. Some researchers have speculated that the British reports are random and prove no real connection between aspirin and cancer prevention. This is refuted with the detail that the patients must be taking 75 to 300 milligrams of aspirin daily. Engineers must be careful when doing work with medicine because the impact on society could be detrimental. So now, understanding the position aspirin is in today, how will aspirin be used and challenged for the future? Once lab technicians, physicians, and engineers find out the secret to aspirin, it has the potential to be used for so many things in the future. Preventer of cancer, heart diseases, stroke in older women, and pain reliever. The challenge will be finding a way to minimize the negative side effects, such as stomach bleeding and hemorrhage. It all depends on the hidden answer of how and why aspirin is helping prevent cancer. Cited sources. Thank you.